The brain is different for everybody. The brain is diverse in the way it develops. And going back to what you were saying, Dave, like it's a neurodevelopmental disorder, meaning that this is from birth. And I think we've come a long way in terms of having students, kids, even some workplaces to involve those who are neurodiverse, whose brains have developed a little bit differently than what we think of as a societal norm. Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area.
All right. Good morning, Andrew.
Good morning, Dave. How are you? It's another Friday.
Yeah, I'm wearing my hoodie, so I'm a little more cash today. And I'm not seeing clients today. It's a PD day, so I'll be spending some family time. Yeah.
Nice. I'm sure you're looking forward to after recording this podcast.
No, I'm looking forward to this podcast too. So it's a topic that we've touched on here and there, and I think, but to actually spend some time specifically focused on autism spectrum disorder or ASD. I know this is an area of specialization for you, so I'll be leaning on your expertise and just probably providing some comments on my own experience within my office and my clinical experience. So let's take it away.
Yeah, so autism spectrum disorder, ASD, I mean, like you mentioned, this is sort of my bread and butter. Started when I was doing my residency out here and had some rotations with kids and families with kids on the spectrum, and just continued down that path with the school board. And I would say even in private practice, this is one of the pieces that we're known for, is working with families and children with ASD, because there are a lot of clinicians who won't, or maybe not have the competence or the know-how. And we've been able to really put it out there that this is what we do. And there's so much to learn about it. And so I'm excited about talking about this, and I'm hoping it doesn't come off as a lecture because of the number of different presentations that I've done to educators, to parents, even to students themselves. There's just so much to talk about. So I have a little bit of a skeleton, but just like many other episodes, I can just sort of see us veering into various directions. So we'll see where we go today.
Yeah, I see today as like an intro. So we'll see how many episodes after that we go more kind of in depth in certain areas. But if we're starting with an intro, I think just, terminology and definitions. So, we can go through the diagnostic criteria. So what is required for someone to be diagnosed with autism or autism spectrum disorder. But I also, even before that, like Asperger's, and there's other terms that aren't used anymore, but people might be familiar with. So I wonder if you can kind of just give, these terms are, synonymous, but aren't used anymore. And so I think this comes up a lot with like ADHD, and people are calling themselves like ADD, and that's not a term that's like used anymore in diagnosis. But so this is an evolving area that I think we need to almost step back a little bit before we move forward.
The history of ASD is really interesting. So when I put together presentations, especially for educators or schools or parents who have very, very little foundation on ASD, I always go back to the history, because I truly think that understanding the history of where the diagnosis comes from provides us with a sense of compassion and empathy towards those who struggle with characteristics of ASD. And for caregivers who do struggle with parenting a child or even a young adult with ASD. ASD, I won't go way back in time, but back in the mid 1900s, people didn't know why. right? People didn't know why individuals were presenting as perhaps sort of quote unquote cold, not having very good social skills, perhaps, nonverbal behaviors, sort of in their own world, relying on others all the time and couldn't live independently. And there was this term called refrigerator mothers that psychiatrists came up with. And the thought of why individuals were seemingly cold, detached, they blamed it on the mothers, right? It must be that your parenting was also very cold and detached, and that's why your child did not develop any kind of attachment, right? And so when you think of that history, we know that that's untrue, right? 100% false.
Mhm.
But when we think of that history, look who was blamed, right? When we think about society, it was the mothers, the caregivers who stayed at home while the fathers went to work.
Yeah.
And of course, that particular train of thought evolved through time. And now we know that that is certainly not the case, right? But also, too, if you think of the marginalization of the ASD population, there were hospitals and asylums that were dedicated to people with intellectual disabilities and autism spectrum disorder, right?
Yeah.
So they were locked up. They were said, you do not belong in society, right? One of the hospitals here in Ontario, Kingston Psychiatric Hospital, which is now closed, but that was one of the places where, yeah, people were locked up and lots of different experiments, right? Lots of experiments, using them as subjects, how can we get them to comply? How can we get them to not scream and to hit others and to come and to just do as they're told, right? So, lots of barbaric kind of treatments. And then that evolved to chemical treatments. And then in the 80s, using lots of different medications, also still considered chemical treatment, perhaps, but things that would just numb them out, numb that population out, and, almost to a catatonic phase, right? And again, then that was seen inhumane. You can't do that, right? So a lot has evolved since then, and now more so community integration, right?
Yeah.
Sometimes there's still prescription medication that's still used for those who do really, really do struggle.
Yeah.
But it's been a really interesting journey from, let's lock them up.
Yeah.
We don't want to see the ASD population to now being in a place where there's more community integration, school integration.
So this neurodevelopmental disability, right? And
Yeah.
correct me if I'm wrong, but that to me means like brain-based
Yeah.
disorder or brain-based
Yes.
challenges. So this
Yes.
whole idea of blaming parenting or blaming environment, like we always think about whether this is nature or nurture, right? And how people develop generally is a combination of nature and nurture, but some things are more nature and some things are more nurture. So when we look at
Absolutely.
attachment can be a lot of like, experience and nurture. So really understanding that this is a brain-based thing and a neurodiverse kind of aspect of humanity, that
Yes.
this isn't, I don't want to go down this hole, but this isn't
This is not
vaccines.
because of
This is,
Tylenol.
yeah, this is not Tylenol. This is not parenting, right? And this isn't all the same. Like we're talking about a population, but there's a lot of, that's why it's called a spectrum now, because
Yeah.
this is not like, okay, just like five things and this is what it looks like. It varies from person to person, but there are some certain characteristics that we, at least those who are writing the diagnostic manual, have clumped together and said, hey, this population tends to have all of these characteristics,
Yeah.
maybe not all of the time, or maybe not in the same way. So
It's
I
not
think,
so black or
yeah,
white. I think a lot of people go through a checklist and think, you know what? I have all of these things and therefore I'm ASD, right? Or I have one of these things and therefore I'm ASD. It's the clinical presentation,
yeah,
right? It's the qualitative aspect that leads us down the road of a diagnosis. And so this is where it's a little bit different from, let's say, a learning disability, where you look at the numbers a lot of the time and you differentiate the numbers and say, okay, the statistics tells me that you have a learning disability. Versus ASD, we're not really looking at numbers here. It's the clinical presentation. How do you function in the community? How do you communicate with others? What is that quality like?
Yeah.
right? This is where when I do an assessment, a lot of parents, caregivers will require that additional explanation.
Hmm.
It's like, how are you making this diagnosis if we do have some numbers, but they might say, well, it seems a little bit arbitrary. But then I really have to explain to them like the quality of how they communicate, the quality in terms of the way they function at school or at home. And so whenever I do an assessment, and this is how thorough I like to be, we will interview parents to see what the child is like at home. We will interview teachers, right? And I might have to bring this back a little bit in a moment, but we interview teachers because we want to know how the child is functioning at school, especially in that very robust social environment, right? If we think of what ASD is, it's a social communication disorder. It's a neurodevelopmental disorder as well. So, social communication, meaning there's a social component and a communication component. And in order to get a really vivid picture of how the student functions, we have to know how they're functioning in the school system or at home or in the community, right? We can't just do a one-on-one assessment and call it a day. Sure, we've got tools like the ADOS, which is, they try to standardize assessment tools.
Hmm.
But if I come across a report and all they've done is the ADOS, I'm going to throw that report out the window.
Absolutely. Yeah, I think, and this is changing a bit, but I know previously when I was doing when we were in the PhD program, we could not make an ASD diagnosis. It had to be referred to an interdisciplinary team,
Yeah,
usually at a hospital like the Glenrose here in Edmonton.
yeah,
And they would require that a standard psychoeducational assessment was done first. And so all the intellectual testing, the academic testing, the social emotional behavior measures on like questionnaires was done in advance. And then their team came in and did all of those extra steps, like you're saying, to
yeah,
provide a diagnosis. Yeah.
yeah.
Oh man. I can I throw one more thing in here just because I
Sure.
it's like bouncing around in my head. When I
Go for it.
when I was doing my master's practicum experience, I actually worked with a child who was on the spectrum. But
Yep.
my training, like I didn't have a lot of experience in advance. And so I relied on my supervisor. But I remember one thing she said. She was like, it's a nonverbal learning disability. And those are a lot of big words. I don't know how many people out there would kind of be able to conceptualize that in a way that's like, oh yeah, I know what that is. So I've been reflecting on that preparing for today, and I was like, nonverbal, so no speaking or lack of verbal language skills, learning disability, so difficulty learning. And I'm like, but that wasn't this kid. This kid was actually really verbal, right?
So
And
that's
could
where I think it would be like the nonverbal means that his weakness or her weakness is in the visual stuff.
Yeah, so the
Yeah.
nonverbal communication,
Yes.
right?
Yes.
So
Yes.
without the words, this
Yes.
child struggled to pick up on nonverbals, right? Like
Yes.
being able to communicate with the other kids or even myself. So it is a nonverbal, like, so some of the people diagnosed, some of the children diagnosed with ASD can be super intelligent and verbal and articulate, but
Absolutely.
struggle in that other area. But here's where I get stuck on it sometimes, or I've had to wrestle with it, was some individuals on the spectrum are also nonverbal. Like they actually
Yes.
do not speak. So they could struggle with that communication verbally too.
Well, that's why it's a spectrum disorder, right? So the whole meaning around the spectrum is that you get a lot of diversity within the ASD population.
Mm-hmm.
And this is again where I always explain to people that on the one end of the spectrum, the extreme end is that you will get people who are nonverbal, right? And they do require the 24/7 care, that they are perhaps very unaware of their environment and will require all sorts of help for many facets of their lives. And then you've got the other end of the spectrum, and this is the population that was once known as having maybe Asperger's disorder,
or high functioning autism.
Yeah. And so the Asperger's piece, like again, historically, that was like the quote unquote high functioning individuals who their social skills might have been delayed, but they can hold a job. They can get through college or university, no issues. But sometimes maybe the way they thought about social relationships or the way they interacted with others might have been somewhat awkward, right? But Asperger's was thrown out the window with the new diagnostic criteria, and now everybody is known as being under the autism spectrum umbrella, right? So yeah, on that extreme end, it's like we do get referrals sometimes from even adults who are like, "Well, I really think I've been on the spectrum my whole life. I work, I have a great job, I have a family, but something's different, right? People sometimes don't get me, or I don't get people." So that's like the high functioning piece versus the low functioning. And then because it's a spectrum, you have everything in between. You have some who are somewhat still, pretty good with social cues, but not the greatest. And then you have those who are, behaviorally, they might, run amok at school and at home, but they're still very intelligent, right? Intelligence is not part of the autism spectrum diagnostics. And that's really important to remember. Has nothing to do with IQ, right? It has nothing to do with how well you do in school. It's your social piece. How do you socialize? What is the quality of that socialization? And what is the quality of the communication? And on top of that, are there routines and behaviors that you really stick to, right? Or perhaps very fixated towards. So the rigidity of those behaviors.
So I think we're doing it. We're starting to go through some of the diagnostic criteria. But before that, like
Yeah.
I'll just make a comment, like you were saying, as clinicians, as assessors, they're looking at, okay, these social challenges, are they related to social anxiety? Could that
Yep.
be what's causing this? Are they related to ADHD? Or
Yep.
is this ASD? And so there's different things that can look like, or the same social challenges can be present. But one of the things with the neurodevelopmental disability is that it has to be there from the beginning. It has to cut across different environments. So it's not the social anxiety piece that, changes depending who's in the room or how many people are there. This is a consistent presentation.
Yep.
And then I think before we go into specific criteria, this neurodiversity term that we've used, and I think we've touched on here and there,
Yep.
but I think this is the way we need to look at this condition or this population, is
Yep.
that this is a naturally occurring diversity within the world of human brains, right?
Yep.
Like,
The brain is different for everybody. The brain is diverse in the way it develops. And going back to what you were saying, Dave, like it's a neurodevelopmental disorder, meaning that this is from birth. And, we will see glimpses of it perhaps throughout childhood. And one piece that I was taught very early on by an amazing supervisor that I had, Dr. Sula Homatitis, who's quite well known here in the province. The way she explained it to me is that sometimes, especially the higher functioning kids, don't get diagnosed or don't get caught is because when you're young, the social demands are very few, right? You go to school in kindergarten or grade one, and everybody's friends, right? Even the teachers regard everybody as friends. A lot of the kids will give high fives and hug, and not as much, discrimination or thinking that, certain kids are awkward. But as you age, right, as you get to, let's say, grades three, four, five, and so on, at every developmental level, social demands become greater.
mhm.
Right. So I'll just take a simple example of, someone maybe in grade eight, grade seven, grade eight, grade nine. We're now talking about how girls and boys will commingle, maybe start talking about girlfriend, boyfriend. And now you have the student who's saying, I don't get it, right? Why are we commingling with the girls or the boys? Or why is someone saying that they like you?
Mhm.
Like, I don't understand that. Now you're seeing those social demands start to catch up, right? So the gap between where your developmental age is and your social age becomes greater
Yeah.
as you get older,
Yeah.
right? So even as adults, when you go to a party, it's like, oh, all these people are talking to each other and they're just chit-chatting about nothing. How come I feel so nervous about doing this? How come I don't know how to get into a conversation or maintain a conversation? And then they look back, it's like, I've always had some difficulty with this.
No, I'm totally with you. When the demands get to a certain point where you can't meet those demands, that's when the challenges start becoming really apparent. And that's when a diagnosis might happen. But
Yeah,
like you said, this starts from birth. This isn't, something that happens after a traumatic event or after a family divorce or separation. This is not related to environment. And some of the cool research, I can't quote it specifically, but just looking at what little babies are looking at in terms of what they're
yeah,
attending to with their eyes
yeah,
when they're interacting with like a
yeah.
caregiver,
The
right?
social gaze. Yeah,
Yeah. So
yeah,
at a very young age, we're starting to be able to recognize that not all brains do the same thing, right? Some babies might not be paying attention to the emotional, more salient aspects of, say, their caregiver's face. They might be paying attention to other things that might be more peripheral. And so this is just like our attention span and what we can attend to is quite limited. So when we
absolutely.
look at that, yeah, and it isn't just one brain area. This is like, yeah, across
It's the whole
different
brain.
brain. Yeah,
It's the whole brain.
it's the whole brain. And so that's why this is more complicated. And it's really cool that some of the like AI technology is actually looking at being able to support diagnosis or support differentiation of
Yeah,
possibly and then, like some really good like solid research around it, not just like watching a TikTok video and being like,
yeah,
oh, I'm on the spectrum. No, this is like there might be ways that technology can help assist us in
yeah.
early detection.
You know what really gets me, Dave? Like within at least, I guess, other professionals in terms of understanding ASD is that I still find that there's very little understanding of ASD, especially in the medical community, unless they're profoundly ASD. Like like you said earlier, there's a lot of concurrent disorders like anxiety and ADHD. A lot of people will fall back to the anxiety and ADHD. So we will see like a 9-year-old who's on maybe like 2 or 3 different medications for anxiety. And to me, that's always a red flag because child only 8 or 9. And here he or she is with anxiety medication, also said to have OCD, also said to have ADHD, and they're so young still. And so when you think of a lot of the overlapping characteristics and symptoms, a lot of the ASD questions start to arise, right? OCD, is there a repetitiveness to their behaviors? But remember, that's part of ASD symptomatology too, right?
Yeah.
And
Yeah.
so a lot of people forget to ask, hey, OCD, there's worries, and then there's the compulsion to act on that worry to alleviate the worry. With our ASD population, they're not alleviating anything. They
Yeah.
just have to do it,
Yeah.
right? So people forget, like, I find a lot of physicians even will forget to ask that. They'll just jump to OCD because they're repetitively doing something. They're not, they don't have any anxiety or worry though
Mhm.
about what they're doing,
Kind of
right?
was chuckling to myself when you brought up like some of the medical professionals don't recognize this or there isn't enough like education.
Not enough
Because
training. Yeah.
yeah, not enough training, but there's also like a lot of physicians and a lot of like medical professionals that are on the spectrum, right? And they're really high functioning and they're really smart and bright and able to like use pattern recognition and brilliant at diagnosis, but the social skills, like the sitting in the office, the soft skills or the bedside manner that people will be like, oh, that person was, really cold and just asked me all these questions about my condition and then wrote me a prescription. It's like, yeah, the like people on the spectrum are all around. And like you were saying, the comorbidity, they could be on the spectrum and also have OCD and also have ADHD. In fact, more than 50%, about 50% or a little higher, have comorbidity. But it depends what we're diagnosing and how it's being treated.
And you know what, you have to know what questions to ask in your assessment, right? And that's what's really lacking. Again, I'll give it a shout out to Queen's University. When I was there for my residency, they had a great program. unfortunately, I thought it was really short, but they had sort of like a 2, 3 day, full day workshops for all medical students. I think they were in their first or second year of medical school, and they had to go through this workshop on understanding intellectual disabilities
Mhm.
and developmental disabilities, including ASD.
Yeah.
But they were, I think they were the only program here in Ontario that provided that kind of level of education. Whereas I know in places like the UK, every doctor or trainee has to go through a rotation with working with those with an intellectual disability or developmental disorder.
Yeah, and I think that's kind of why we wanted to talk about this today too, right? Like this is the general public, even professionals have very limited. I know I had to do my own kind of additional training after my training, right? And then I'm still learning as I'm going. Like I'll still be surprised at times where I'm working with a couple and they're having challenges with communication and we're a couple sessions in, and once this like ASD lens, like, oh, so here's a real life example. Like someone discloses that or shares that their child is being assessed for autism. And it's like, oh, and now I start thinking about autism and I start thinking about the spectrum and I'm like, oh my goodness, right? This helps me understand a lot of what I've been seeing. But
Yes.
but like you said, like there's a whole bunch of ways to just see parts of it and to see it through that lens and to go like, oh, this is anxiety, or this is like a man who isn't, in touch with his feelings and has a difficult time expressing his emotions, right? And it's
Yeah.
like, yeah, that's true. And if this person is on the spectrum, it makes a whole lot more sense why the
Yeah.
challenges present themselves in that way.
Well, think about this, Dave. If your diagnostics is wrong, right? Let's say someone gets is being treated for anxiety. Now, there may be some degree of anxiety because we know that, from research, those with ASD are at a higher chance of struggling with clinical anxiety or ADHD, right?
Mm-hmm.
But let's say all you focus on is the anxiety, right? You're missing a whole social component part of this person's presentation and understanding that you may be doing CBT, but it's not it's not resonating with them because they don't understand why do I need to greet people?
Well,
Right?
and maybe changing their thoughts is not
Yeah.
actually gonna.
No.
So I like to actually think about it now. Instead of it being anxiety, it's distress. It's a distress felt in the body, and it could show up
Yes.
like anxiety symptoms, like stomach issues, or some of these other things that go along with anxiety. But it's like maybe it's the clothes they're wearing,
Yeah.
maybe it's the stimulus that's in the environment that's
Yeah.
distressing their nervous system,
Yeah.
right? And all the
How
CBT in the
loud?
world is
Yeah.
not going to help with that, right? Yeah.
Exactly. So let's say you're trying to help them think through, it's a loud environment. Well, let's cope with the loudness of it, right? How do we rethink the loudness? People having a good time and you're going to have a good time too. It's like, no, you know what? It's a sensory issue here, right? They can't just start thinking about, I'm going to have a good time. To them, everything is amplified like 20 times. Right. So it actually hurts their ears to be in this gym environment or in this club. So we have to help them understand that this is them, right? So how do we make it manageable? Maybe going to a different environment, maybe suggesting to a couple of their friends that, hey, why don't we not go to the club? Right? What if we just stay in and play board games or watch a movie or something?
If we go back to neurodiversity, right? And we look at that, I think traditionally for a large part of our history and where things were for a long time, it was like how to get people to fit into the norm,
Yeah.
right? So if you have these sensory challenges, you need to, not be so rigid or not be so sensitive. Like like get over it and kind of fit in to the way the classroom is organized or the home is organized or the clothes that you were bought, right? And so now the neurodiversity approach or lens is like, how do we accommodate and accept the diversity that people are born into this world with, right? And how do we
Yeah.
adjust environments to support the differences that people have rather than expecting people to fit into the one way or the two ways that's available because 90% of people like it that way.
Yeah. Man, that's like that's a huge question. And even possibly a political one too, right? I think we've come a long way in terms of having students, kids, even some workplaces to involve those who are neurodiverse, whose brains have developed a little bit differently than the norm or what we think of as a societal norm. And we have come a long way in integrating students. I think there's still a long way to go. And unfortunately, going back to some of our talks about developmental psychology and categorization, right? When kids or students see something that's different, I think kids can still be pretty mean. I know they can still be pretty mean. And adults can also perpetuate that, behind closed doors or nowadays even like blatantly in front of the media. Right. So part of me sort of feels like, even though we've come a long way, there's still a long way to go in terms of integrating and accepting those who are neurodiverse. It doesn't help that, you have certain leaders who perpetuate, the stigma of someone taking Tylenol or, vaccines cause ASD when, the research has shown that it doesn't.
Well, you know what? My heart breaks. Like it just is like I see this at the men's group. You'll see this in any group setting, right? Even in the behavioral measures questionnaires, like they're deemed as odd behaviors, and they are. They're odd because they're not as common as other behaviors, right? But these socially awkward or odd or weird, different, all these terms that we have to label these kinds of like behaviors or these presentations or these ways that people are in the world, and it's a negative stigma to it, right? And
Yep.
if it's something you can't change, like like your skin color, then negative stigma to things that people cannot change, that absolutely breaks my heart. Like I just think like we need more education and more understanding to, because I've seen this, and I don't work a lot in this population, but in my clinical experience, adults on the spectrum who are not diagnosed, who do not have that kind of understanding, and their work environment and their home environment and other environments are not supportive of their differences or their challenges, they actually don't want to live. Like every day
Yeah.
there's thoughts of suicide and thoughts of like leaving this because it is so painful. So you made a comment that like they're functioning quite well. And I think on the surface, a lot of people, especially those the high functioning, can function quite well. But on in the inside, it is quite painful and distressing and often leads to burnout. And yeah.
Well, this is why I think oftentimes they show up at our offices because there is something grinding at them within, right? Like something is just different. Sometimes those who are more self-aware, who are, let's say, higher functioning, they're more introspective as well, right? And they're able to think a little bit more about their experiences and why am I like this? How come I have such deficits or weaknesses in these areas? I don't get it. And so they
Mhm.
show up at our offices looking for an answer, right? Am I on the spectrum? And if I am, can you help me? Because this has been bothering me since I was a teenager, right? And it's gotten to the point where, look, I can't get into a relationship and, I'm lonely, I want a relationship of
Yeah.
some sort. And, if I don't, like, I think I'm depressed.
And as you're talking again, the files in my brain start opening up, and I'm like, oh, in my training, I was doing some work at a community-based clinic, and this young man, comes in and with anxiety, right? And I'm like, anxiety? I know how to help with anxiety, right? But as we're working together, there are so many social communication aspects. And one of the things was, like you said, relationships. So this young man wanted to get into a relationship, but oh my goodness, the challenges that were happening, like even in the workplace,
Yeah.
that there was reports to HR, right? That this person is,
Yeah.
there might be different words for it, but like creepy or not respecting boundaries or like being aggressive. And he would come to me and he would be like, "Oh, I'm just doing what other people are doing or what I like seeing on TV in terms of like, what do you do when you like someone?" Right?
Yeah.
You pursue them. You like this, like, I was thinking about this yesterday leading up to today. I'm like, this like hard to get, like how people play hard to get, like how
Yeah.
confusing that can be for someone on the spectrum who's like, okay, so when you say no, you actually mean try harder.
Yeah.
Okay, I can do that. Well, actually, that is stalking, or that is like
Yes.
can lead to criminal charges because when someone says no, you should respect that they're saying no, that they don't want this, right? And so, how confusing our social interactions are that we, at least for myself, like someone not on the spectrum, can just take for granted.
This is what we call the cloak of competence, right? So this is a term I like to use as I'm explaining because when I work with educators and I go to the school meetings and they're like, well, yeah, but so and so like they speak so eloquently and they can tell me all the facts. We can have a decent conversation from time to time. So I don't think anything's wrong. And then I go, well, really think about this for a moment though. What are your conversations about a lot of the time? And usually it's very surface level stuff, right? How did the Blue Jays do yesterday? Did they win? Did they lose? And then, sure, they can tell you certain facts sometimes of how they should behave, but then they can't actually do it in the moment, right? So it's sort of this cloak of competence, right? There's this sort of veil that makes you think that they're very competent, but in fact, they lack the competence. And this is sometimes with our population. I fear and I worry, and I tell parents this, that they can get taken advantage of, right? Because you can tell them, hey, if you go and take something from the convenience store there, we'll be your friends. And if you think of the ASD population, if you have a student who's really longing for connection, who's really longing for friends, that pull, that drive might be so strong that, hey, I want friends, and these are the coolest kids I know, right? So all I have to do is take a candy bar from a convenience store. I can do that, right? And so they get duped into these things and they don't actually compute what is the consequence of this, right? That competence piece. Can they get around their environment competently? They may seem like they can, but in reality, when we ask them to act on it, they can't, or it's very challenging.
Yeah, and even just that like longing for connection. And it's like probably an area that is the most difficult, right? And what people will do to get that connection. It's like, and you'll see this, at least I see this in like, couples therapy. Again, it's like I did everything. I did what like these adults have learned the rules to like get love, and yet there still is this like, so even if there is that cloak of what did you call it,
Competence.
competence, yeah,
Yeah.
so it looks like they are competent in this area, like they can do social interactions and they've figured it out. The amount of effort that it
Yes.
takes, like for others that have learned this by just observing and modeling and interacting with other people, they've somehow internalized a lot of these social cues, social rules, and it just is kind of like they can't even explain why they do what they do. Whereas someone with ASD,
Yeah.
they have all of these rules. It's like, okay, ask more questions because that
Yeah.
helps communication, right?
Yeah.
People don't like when you just talk really long about a really specific interest.
Yeah.
Okay, I've learned that, right? Like, so
Yes. Yes. Well, this is why social outings can be so exhausting for those who are on the
yeah,
spectrum, right? They
yeah,
have to put on this sort of mask
yeah,
and pretend to be outgoing or to make conversation. And by the end of it, they go home and they are drained. So again, when I work with families and the parents are like, well, we got to improve his or her social skills, and therefore we're signing him or her up for this and that and the other and 7 days a week. I always say, give them a break. If they're asking for a break, give them a break. Maybe on Sunday, Saturday, they don't do a thing. That is their time to just chill out, be by themselves if that's what they need. Because look, Monday to Friday, if they're in school, that's a lot of socializing and they are tired, right?
That's where this education needs to happen, is because more exposure to social interactions is not going to lead to better social skills, like for this
Yeah,
population, right? So
yeah,
perhaps, maybe to some degree, right? But this is not like a lack of exposure, and they need more social interaction, like you said. And I mean, I see this a lot from the adult population. It's like they have actually found jobs where there's very little social interaction, and that helps them kind of be successful and have less stress or less distress. But then there's the community barbecues and the community like team building events and these like things
they
where we think,
dread them.
yeah, and it's like, oh no, these are good things, right? Well, they're good
Yeah,
things for 90% of the population.
yeah,
They'll get through it. But getting on a bus and going on a retreat, like to a ski trip or to like, this is just torture. Like it is absolutely painful and
yeah,
can lead to like really like physical symptoms of rashes and
yeah.
stomach issues and headaches and all of these things when our body is really stressed.
Yeah. Yeah. No, that's a great point. You see that in the workplace and you also see that in school. So even as I'm thinking about it right now, like mirroring, any social environment, whether it's school, even sports teams, like I have students who will say, I hate team sports.
Yeah.
Like, I don't know why I have to pass the ball, right? But then I get yelled at even though I score, right?
Yeah.
So why
Yeah.
do I have to pass it if that other kid sucks? It's like, it's a team game, right? Like, and so they'll gravitate towards things like swimming,
Yeah.
right?
Yeah. Yeah.
Yeah,
Well, it's a social element, right? Like
yes,
it's the politics at work or the politics at school that like don't make sense. Like
yes,
if the goal is winning and I'm scoring more, why would I pass to someone who sucks, right?
yeah.
Well, guess what? Like if you want to have friends on the team, right? That's and then it's like, well, why would that?
Why
It's
does it
really
matter?
confusing. It's
Yeah,
really confusing. It doesn't come intuitively. So
yeah,
I don't know if in the last 5 minutes we can walk through some of the highlights, some of the kind of we've been touching on them, but some of the more like diagnostic criteria that is part of this diagnosis, at least as it is now in the DSM. And I always like have a bit of caution around these things do change with research, and there is no blood test for this, right?
no,
So
no, no. I think for me, this is such an intro. It
okay,
really is an intro. Like we barely scratched the surface. And we will have a part two on this. So this will be the part two will be recorded after. But I think in terms of the highlights, like you were saying, there's no blood tests, there's no vaccine that causes autism. Tylenol doesn't, a mother who's pregnant taking Tylenol is not going to give autism to their unborn child. It is a neurodevelopmental disorder. It is from birth. The way it presents itself throughout childhood may be different. And so sometimes we get an 8-year-old who comes in and whose parents will be like, we didn't see any of this stuff earlier on. But I really caution that because it does take a skilled clinician to ask the appropriate questions going back to maybe when a child was 3, 4, 5 years old in order to really dig deeper as to whether or not there were some red flags. And I say 3, 4, 5 years old because this is really the beginning of socialization for children. Socialization with parents, sure, at home with siblings. Now, unless they are, again, on the very severe end of autism, you might see that when they're like 2 years old, two and a half. But when they go to daycare and they go to kindergarten and they have to socialize with so many other children, sometimes this is when some of those red flags come up because now teachers, educators, other people see that, oh, something's different.
Oh, oh man.
Like,
Yeah, I'm
I don't know
listening
what you're
to you.
thinking.
Yeah, I'm gonna share it. I'm kind of on the fence, but I'm like watching my oldest son grow up, like, and having this knowledge, and I was literally kind of going like, what is this about, right? So I'll give you a quick example. Like he would line up all his toys in a very specific line, and if they were out of place or if one got moved, it was like this huge meltdown. Or if his little brother, when he got a little bit older, his little brother would come and knock over some of the things, right? And so I was like, oh, okay, like what is going on here, right? Like, so I'm looking for these indications. And to be quite honest, some people like educators or childcare providers were flagging it as like ASD, right? And so saying like, I think your son like, so I was I was I might be more sensitive to it, right? But like being able to be aware of some of these things. And I'll give you another quick example. You know those hair or hand dryers in the
Yeah.
washrooms?
Yeah, yeah.
I would like be ahead of my son to like wash my hands first and then help him. And I would hit that hand dryer and he would just scream. Like the sound, I don't know, the sensory aspect of it. And still to this day, I have to put my hands over, actually, both my boys, over their ears while they're drying their hands with these hand dryers because it is just too much.
So
Right.
loud. Yeah.
Yeah, and I think
Yeah.
we'll do part two and we'll look at like some of the diagnostic criteria and some of the indicators. But it's like, telling a kid to just be okay with something.
No.
Yeah, like so if anything, if you take away anything from this episode and from the future episodes, it's like these are not things that change, and these are not things that like people can just learn to not care about. Like these are
Yep.
like hardwired in the brain,
Yep.
hardwired in the nervous system. And the more we can accommodate folks with this
Yes.
diversity, the better
Yes.
the world will be.
I'm glad you brought that up because I really do want to record an episode on strategies and interventions and accommodations because so many times we get referrals and, again, educators or parents will be like, you know, help them figure things out. And again, I think we've emphasized this multiple times now on the podcast. It takes a team, right? I cannot expect a child to all of a sudden be able to say, okay, cover your own ears when you don't like something, right? They will need reminders, they will need prompting, right? So when we get there, when we talk about some of those interventions and accommodations, it'll be really interesting, because accommodating the environment is very important. It's not just changing from within. You got to change the outside too from time to time.
Yeah, we touched on it, and I'll just make this one last comment. Like kids' birthday parties, those will
Yep.
be the,
Oh my gosh.
like where is the birthday hosted? Like what are the activities going to be there? How many kids are going to be there? And again, for 90% of the kids, they're looking forward to this. It's super fun. They come home happy. Other kids with different brains are going to really struggle in those settings. And if you were a parent who grew up like enjoying those things, it might be really hard to understand why your child struggles in those areas.
Yep, absolutely. So stay tuned. There's going to be a part two, possibly a part three.
Well,
I got,
yeah, I'm going to make one last comment because I'm like, I hate that. I mean, I know I'm not on the spectrum. I don't think you're on the spectrum. I hate that we're talking about people on the spectrum, right? Like, so hopefully there's ways to kind of, I know I'm going to make a reference to one podcast that I really like, the neurodivergent experience, and the
yep,
actual hosts are on the spectrum. And so there's a lot there's a lot of cool stuff happening where it's not just like professionals talking about people with a certain diagnosis, right? That there's people on the spectrum speaking for themselves and talking about their experience. And I
yep.
I really want to emphasize that that's important too. And we're doing our best with what we know and what we can help kind of share information with.
Well, in our experience, in our education, in our knowledge, but yeah, I think you bring up a good point. Perhaps at some point we do bring on a guest who's on the spectrum, right?
Yeah.
So who's neurodiverse. So yeah.
If you're listening and you identify and been diagnosed and want to come have a chat with us, the invitation's open.
All right, Dave. So we will get to part 2. We'll chat more about this because there's so much to talk about. And until next time, take good care.
Take care. If you like this, hit subscribe, like, do all the things, give us comments. Yeah. All right. Take care.